Good morning, distinguished participants. You are welcome to webinar for retirees this morning. I recognize all retired permanent secretaries, retired directors, and all participants. This morning, we are going to be looking at asthma. I'm sure we are all familiar with that medical condition. It's a respiratory condition that sometimes makes breathing very difficult. And if care is not taken and proper medication can lead to untimely death. Once again, I welcome you on behalf of the head of service, Mr. Bodea Guru, and the permanent secretary, Public Service Office, Mrs. Sukomi Oyegbola. They are both unavoidably absent this morning. They are on a special assignment. So I am going to be your host today. I'm going to handle every aspect with Dr. Yekubu, who is our facilitator on this session. So without wasting much of our time, let me just take a brief profile of Dr. Yekubu. Dr. Yekubu is a hardworking and a dedicated medical officer. She graduated from the University of First Choice and Nation's Pride, the University of Lagos. She has passion for emergency stroke trauma aspect of medicine and has worked briefly at Lagos State Accident and Emergency Center. She currently works with the Lagos State Ministry of Health. She has a very creative and imaginative mind with self-motivating abilities. She also volunteered for community outreaches to help improve health and health-seeking behaviors. When she's not working, she enjoys creating content, playing volleyball, and reading. On that note, I'd like to welcome Dr. Yekubu to unmute and go ahead with our presentation. Please unmute Dr. Yekubu.
Good morning, ma. Can you hear me?
You can go ahead with your presentation.
Okay. Ma, can you see my screen?
Yes, I'm seeing your screen. Go ahead.
Good morning, sirs and mas. My name is Dr. Yekubu, and I'll be taking us on bronchial asthma. Because I want to be sure if everybody can hear me and see my screen as well.
Yeah, I'm sure they can hear you, but you need to be more audible. I don't know. Maybe your gadget is far away somehow, or the volume is low.
Okay, ma. Is it better now?
No. Okay, so maybe it's my own gadget. Participants are saying they can hear you very clearly. So please go ahead.
Okay, ma. Thank you very much. Okay, good morning, sirs and mas. My name is Dr. Yekubu Karimah, and I'll be taking us on bronchial asthma. using the following outlines: introduction, then pathogenesis and risk factors, which basically gives us an insight on things that can predispose a person to having asthma. Then the symptoms, what are the things we look out for to know the person has asthma symptoms? Complications, if asthma is not properly treated or managed, what are the things that can arise from that? Diagnosis, what are the tests to carry out or the things to look out for as well to know that what you are dealing with is asthma? Then the treatment and conclusion. So what is asthma? The most basic thing to know about asthma is that it is a disease of the airway. It's a disease of the airway. So, and what do I mean by airway? The same way we have, can you hear me? Hello? Hello, ma? My network. Hello, can anybody hear me? Okay. Okay, thank you very much. So I said basically it is a disease of the airway. And when I say airway, the same way we have it like a pipe when we eat, the same way we have like a pipe that carries food down to our stomach. The same way we have a pipe-like structure that also takes air when we breathe into the lungs as well. So asthma basically affects that pipe, that airway that takes air takes the air we breathe down to our lungs. That's the basic thing to know that asthma affects the airways. So it occurs due to hyper-responsiveness to a variety of triggers. So when, for example, you are walking on the road and maybe you hit your leg on maybe an object and all of a sudden it becomes swollen. That is like the body's response to tell you that there's like an injury here now. There's like an insult to a part of your body that has caused for some chemicals to be released and from cells to be formed around that area, which causes the swelling. Same thing happens in asthma. When an external trigger, like maybe a smoky area, or maybe somebody frying something, and that bad air is like an insult to the airway as well. So the body also responds by releasing chemicals and cells to go around that place and causes that area to swell. And like I explained, the airway is like a pipe. So when there's a pipe and there's an insult to the pipe, because it's swelling. And when there's a swelling, you can imagine this is a pipe, and when there's a swelling, that airway narrows. And when it narrows, the person starts finding it hard to breathe. So that is basically what happens in asthma. Someone that is not prone to having asthma can just pass a smoky area and then just sneeze and move on. But in asthma, there is hyper responsiveness. Those cells are being sent like more times than in a normal person without asthma. So that's the difference between a person with asthma and a person with asthma. And it can be mild in some cases, and it can be severe in some cases where it will affect the person's daily life. Before they move from one spot to another, they're already having the attacks. So like I said earlier, it's a common disease that affects the daily activity of a human that is affected. And basically, since it is a disease of the airway, it will come with respiratory symptoms. The respiratory symptoms, that involve symptoms involving breathing, having cough, and having chest tightness. And at that moment when they're having the attack, they really cannot take air in or even out of their lungs. So it should be known that it is not curable, but it can be managed subsequently to help people live better. Unlike before, where we didn't have much knowledge about it, the rate of deaths were higher in the past, unlike now, that people are more aware of the disease. So epidemiology, it is one of the world's most common long-term conditions. Yet a long-term condition, and it is estimated to affect as many as 300 million people worldwide and could increase by another 100 million by year 25. So unlike before, that it wasn't as common in this part of our world, the prevalence is getting higher in Africa and in Nigeria as well. And it ranges from 14 to 18% in the general population, and it is seen to be high among university students in the southwest and adolescents in the eastern region, and also among adults in the north central part of Nigeria. So it has increased remarkably over the years, and we are just grateful that people are more aware of it and there's better health seeking behavior. So the risk for asthma that has been identified in Nigeria is usually a family history of asthma and some triggers as well, both outdoor and indoor, and smoking. I will list some of the triggers subsequently. Smoking and also obesity. Like I mentioned earlier, there's a recent decline in mortality, that's death due to asthma. It has really declined, unlike before when people were not aware of the disease or how to manage it properly. But then it's also known that the rate of death increases with age. So older people tend to die more from asthma, and also female sex, and also we blacks. So for what causes asthma, many asthma genes have been identified, and since we know, like I mentioned earlier, that it is hereditary. So I know when a child is born, they get genes from their father and from their mother. So if it could be the father that is asthmatic or the mother. So the child automatically would have the genes that will make them prone to having asthma. That does not eventually mean they will start having recurrent attacks of asthma, but then if they are exposed to something that they are allergic to, it will trigger that gene and cause them to have attacks. So the asthma basically occurs, the asthma basically occurs as a result of interaction between genetics, the person's genetic makeup, and the environmental factors, which are those triggers I talked about. So like I mentioned earlier, that when there's an insult to a particular area, chemicals are released, cells are released. So now, what I mean by is an interaction between the genetic and environment. So when there's an insult from the environment, like maybe smoke or dust, the internal environment as well and the external environment is like a fight between them. Like the soldiers inside and the soldiers outside are basically in a war. So that one causes like some form of swelling. That's what we call inflammation. That causes inside the pipe, which is the airway, that causes the swelling, that causes excess production of mucus. And those things keep making the airway narrow and narrow and narrow, and that will make the person find it very, very difficult to breathe. So when the person gets exposed, I mentioned this earlier, when the person gets exposed to an external factor, there's a release of a group of cells and chemicals that will cause for constriction and edema. Edema basically means swelling. I'm assuming this is the pipe. So when there's a swelling, you can imagine when there's a swelling inside, it gets narrow and narrow. And sometimes subsequently, if it is not properly managed, even when the person is not exposed to triggers, no matter how tiny it is, if the person does not control it properly, the person start getting this response, this inflammatory response that I talked about, even when the triggers are not there. That is if the asthma is not properly managed. So this is basically a diagram showing that when there's a trigger, it causes inflammation, which is the release of those cells, those chemicals that tells you that, oh, there's an injury here, there's something happening here that we don't like. So release cells, release more soldiers, release more soldiers. Those soldiers keep piling up and cause that swelling. So then there's excess secretion of mucus. Those mucus can attach to the airway wall as well, still causing difficulty in breathing. There's constriction, like I mentioned. Where we have muscles on our body, within the airway as well, there's some smooth muscles there too that can constrict, like reduce inside, like come together rather. So it narrows the breathing passages. So when that place is smaller, where air is passing is smaller, it makes the person find it difficult to breathe. And then they come down with these symptoms that are listed here. They can have cough, shortness of breath, where they are unable to take deep breaths into their lungs or even release the air in their lungs, and then wheezing. Then when they are breathing, you hear sound like a whistling sound, like you can hear them even while sitting beside them. So this is what a normal lung lining looks like. You can see that there's enough space for air to come in, right? But here, you can see how thickened it has been. You can see how thickened the wall has been. So this is where air has to pass. And that will basically cause stressful breathing for the person. So it's also known that male gender is a risk factor. That means being a male can predispose you to having, or basically have it more, it occurs more in them than children, than females rather, that is in children. Then in children less than 14 years, asthma is twice as more in boys than girls. That's children less than 14 years, it occurs more, like times 2 in boys than girls. But then in adulthood, the females, like it increases for the females more than the males. So the environmental factors are outdoor and indoor allergens. Allergens are just basically things that can give a person allergic reaction. There is just allergic reaction that will cause person to have asthma attacks. So infection, sometimes maybe common cold or any other infection, and depends on the timing. It could be in this, like some people, this harmattan period can be like a really tough time for them, for people that are predisposed to asthma. And occupational asthma, some people that work in a particular place where they are exposed to certain chemicals over time, you can also predispose them to having it. So these are just the triggers that can occur. Medicine, there's some drugs that can predispose you to having asthma. And that's why sometimes when we are prescribing medications for patients generally, we ask them, are you asthmatic? I'm sure some of you have experienced whether you're asthmatic or do you have ulcer and all of that. So for asthma, because there's some drugs like NSAIDs, we call them NSAIDs, like ibuprofen, naproxen. So those drugs we cannot give to those asthmatic because it can actually trigger an attack for them. And some antihypertensive drugs too, like propranolol, some of those beta blockers, we call them beta blockers, and some of the examples, propranolol, atenolol, those drugs as well can trigger asthma in someone that is susceptible to having asthma. Then smoking as well, stress, cold air. There's some food too that might contain something that the person might be allergic to. I feel like as humans, we don't generally know everything we're allergic to because we've not inhaled everything, we've not eaten everything. So sometimes it's good to look out for any certain reaction, no matter how little, that we have to anything we put in our mouth. Then pollution, we are passing at a very dirty environment, and maybe where there are industries everywhere and there are smokes everywhere. It can trigger the asthma for some people. Then dust mites. Dust mites they basically live in dust, and they can be seen in areas like the rugs, teddy bears, bedrooms, chairs, within chairs. So that's one common allergen that affects people as well. So, and infections. Person can have an infection and this can trigger their attack. So what are the symptoms that these people with asthma come up with? I feel like I've mentioned some of it, but the reason that I talked about that when they are breathing, due to the narrowing of that airway, it is difficult for air to pass. So I know that if, let's say by chance, you're passing through a road and it's very free, everybody's passing freely. But if it is tightened, there might be some scratching, and that's basically an example of what will produce the wheezing. Difficulty in breathing, shortness of breath. There's no space for the air to pass freely to the lungs or to come out freely. So they cannot take deep breaths. So it's always short. So you see them basically struggling, and then they have cough, and they have chest tightness. So that tightness is just that feeling of their airway closing up. That's what tightness is. And then they have when they cough, they have thick mucus that comes out. So these are still the symptoms that I just mentioned just now. Still the symptoms. There's some symptoms that can be so plain that you might not quickly suspect. Common cold, chest pain, although there are other things that can cause this, but then these are some other symptoms that can occur when somebody has an asthma attack. They can be feeling fatigued, that means feeling tired, then they have cough, their heart is beating really, really fast, and they're really sneezing, having allergies, sneezing, any small thing they're sneezing, sleep problems, because for one, they're even having difficulty in breathing, and they might need to look for a better position that might help them. And they might have headache as well because they're stressing themselves, trying to breathe properly. So they're already mentally stressed. Their daily activities are already compromised. So for diagnosis, usually diagnosis can start from when the person comes to the hospital and is telling you the symptoms. And so when the person comes and you're hearing symptoms, like you're hearing history like, oh, this thing started when my mother was cooking something and she was frying something. When she started frying the oil, or maybe they got a new pet at home. Some of these dogs, or those very furry animals, or they got a teddy bear, or they passed the dusty area. That's when it started, and that's when they started having this difficulty in breathing. From there, you're already having an idea that this is most likely going to be an asthma. So although sometimes, like I said, other diseases as well present with cough, difficulty in breathing, and sneezing and all of that. So, but when they have more than one symptoms, and maybe where they're breathing, that wheezing sound is occurring, they're feeling like their chest, their airway is closing up, and they're having shortness of breath, especially in adults that can describe these symptoms. You are tilting more towards asthma, and then it's usually worse at night or early in the morning. So, and so like I said, you could have heard from their story that maybe they were exposed to something outside that triggered the attack. Viral infection like common colds, car exhaust fumes, strong smell. Some people, you might just spray perfume around them and they're already triggered. So following this history from the patient, there's a test that you can do, that you can perform to actually confirm that, okay, it's asthma. It's called spirometry. So basically, there's some okay, this is it. So you use this device. So there's some medications that can reverse, like the way the airway is closing. There's some medication that can help you reverse it. So when you give them this device to blow on, so that's when you use to assess. It basically helps to measure how much air the person can blow out from their lungs. So that's for you to know the strength of their airway. Do you understand? So just for you to know the strength, because if my airway is very, very clear and open, I'm basically taking a deep breath and blowing it out. But if I have to force myself and to blow out hard, this peak flow meter basically shows you the strength of the airway. So it shows the ability to push out air out of the lungs, and the measurement can be important in asthma diagnosis and management. So sometimes you can use that as a form of management as well, because when they blow out air from using that device, and you notice that maybe the strength is low, then you give them the medication that can reverse that narrowing of the airway. So when you give them, then you tell them to blow it again. I see that there's improvements. That basically just tells you that, oh, okay, this person is asthma. It basically helps you in diagnosing it and then treating the person while examining the person. So it's also important to assess the severity of asthma, because sometimes some very, very extreme cases, they might come in very, very bad states. They are confused. They don't know where they are. And so it's important to note that as well. So you check their oxygen level too, because it is our, if there's good ability to breathe in and breathe out, when you check your oxygen level, you get good values, 99, 100, and all of that. But when you check that level and it is low, you know patient that you need to give extra care to, that maybe it's not just the reversible medications that you give to them.
You have to unmute yourself, doctor. Please unmute. Doctor, unmute. I think she's having a bit of a challenge with her network. Let's just wait for her. Okay, I think she's back. Please unmute. Doctor, unmute.
Okay, you can hear me now.
Yes, you're audible now.
Please, I hope we got it up to the treatment. Or where did we stop?
No, we didn't get it up to the treatment.
Okay. Where did we stop? Where did we stop, please, ma'am?
I think the slide before this.
Okay. So here?
Yes.
Okay. So should I just take this slide again?
No, I think you can go to the next slide. We got this one. You can go to the next one.
Okay, ma'am. Okay, ma'am. So the next one after this is just the treatment.
You can start with the treatment, yes.
Okay. Okay, so like I was saying, the goal of treatment is basically to achieve, maintain control and reduce risk factors, reduce future risk of asthma attack. Because this is Nigeria. We are exposed to dust, we are exposed to smoke, we are basically all passive smokers, and some are actually active smokers. So this is a country where you have to go out every day, you are exposed to dust, pollution. So there's no way that you can exactly totally avoid these triggers, and you don't know what might trigger your asthma today or tomorrow. So the goal of treatment is to make the person at least able to live their daily lives without having to be worried that, oh, what if I go out today and this just happens. So the goal of treatment to avoid risk factors, and also for patients to understand the difference between they have controller and reliever medications. I'll talk about that subsequently. So the controller medications help to prevent asthma attacks and to control the symptoms. Asthma attacks, future asthma attacks, one that you've not even had yet, to prevent it from, to relieve the symptoms they're having at that moment. So when they're having their attacks at that moment, you have reliever medications to relieve them. So we also want to ensure that they are using their inhaler correctly, and also counsel people on the importance of adhering to their treatment regimen. You cannot just say because it happened to me last 2 months, it doesn't mean you should not be worried about it anymore. So also to monitor their symptoms, to go to clinics when they have their appointments, to do that test I told you about, where they have to blow into that device and to just know the strength of their breathing, and to also recognize the signs that the asthma is getting worse, and when to take action, or when the trigger comes, what you should do immediately, and to basically seek medical help as appropriate and not overlook the symptoms. So, so the medication aspect, we have controllers with medication, reliever medication, and medication where you have to inhale or that get injected. The corticosteroids that they inhale or that they get as injection, then leukotriene modifiers. This one are basically to help with all those inflammation that I mentioned earlier as well. The release of all those cells that will be going to cause swelling in the airway. So the non-medicine aspect of it is to limit exposure to, if you know that there's a certain thing that you are allergic to that causes triggers, the first and best treatment for yourself is to avoid exposure to that and those allergic things that you know yourself know, like can identify. So maybe at home you have rugs, you can basically change the rugs to carpets. If you have pets, I don't know, maybe other somebody else should adopt it since it's not working for you. Your health first, and then good hygiene around the house to avoid them dust that can predispose you to having dust mites and affect and trigger your symptoms. So just basically preventing anything that can cause triggers for you, if it's a particular food or drug. And also when you're getting drugs for other things in the hospital, it's always nice to tell them, doctor, I am asthmatic, please, when you are prescribing your drugs for me, because now you are all aware that some drugs that they should not be given. Some of the painkillers I will just buy over the counter, ibuprofen, I'll give ibuprofen. Some of those things can trigger asthma in some people. So it's good to know and tell your doctor that please I'm asthmatic. So in case, so when you're prescribing, know things that you prescribe from me. So those controllers and relievers medication. So the controllers will help to treat all those inflammation in the all those swelling and everything that are in the airway, in that pipe. And the relievers immediately they give you the fast temporary relief. At least let me even breathe well first. That chest tightness you're having, you just take some of those relievers. At least just gives you hope that you are still alive, you are still breathing. The relievers medication, they will relax the airway for you. They just relax it and tell the airway calm. It's just dust. You don't have to fight and fight, continue fighting. Please just relax. That's basically what the relievers. And the common one we use are the salbutamol, salmeterol, occasionally, especially when the patient has all those flares. Then the controllers, those are those ones that improve symptoms in long term and they prevent future episodes, like I mentioned earlier. So, and the examples we have are budesonide, fluticasone, and those ones should be used more regularly because we don't want to have attacks later in the future. This shows the level of severity, how to know. This just very simple. So if your breathing is still good, there's no cough, you're not feeling like your chest is closing up, you're not having difficulty breathing day or night, day or at night, during the day or at night, you can still walk and you can still play and sleep well. Just take your normal medication that has been prescribed to you. But if breathing is getting worse, and then you're having that whistling sound, that wheezing sound, like I said, sound like this one, you feel like your airway is closing up during the day, and you're having difficult, so finding difficult to exercise. Maybe you walk somewhere like on the third floor, and you're finding difficult to even get there. You can the reliever medications as well to help you relieve your symptoms. Then if the breathing is now difficult, that's this red one down here. You can see this one, the top one is green, the breathing is still good. And the getting worse, then the red, breathing is difficult, and you have hard breath, take up to 10 puffs every 30 to 60 seconds, and repeat like every 20 minutes. Take one of the controller medications as well. And also, if you are, it depends on how you are feeling, the best thing is to seek help, go to an emergency center immediately, so they can check your oxygen level and place you on something that will at least stabilize you. So complication, what are the things that can happen? Like every other thing, if you do not manage asthma very well, it's like you are stressing the airway. This airway keeps working. Every time there's an insult, it keeps working, it keeps working, it keeps working. Gets swollen, gets swollen, gets swollen. Just like the way when people go to the gym and they keep their muscle area starts increasing. So the same way you are stressed, and I told you that there's also muscle within the airway. So the same way you are stressing the muscle, it thickens. Like I showed the picture earlier, how a normal airway will look and how asthmatic one will look. So the way those two get thickened, so the wall of the airway to start getting thicker and thicker and thicker and thicker, and causes and makes the structure of the airway permanently thick like that. So someone like that probably be admitted more, they put on more medications because just basic one that they will just puff cannot reverse their symptoms anymore. Some people even die because of neglect or when they are not prompt.
I think we lost her again. Let's just wait for her. I'm sure she will be back soon. While we are waiting for her, if we have questions, let's just be typing our questions on the chat. Let's be typing our questions on the chat. Okay, I think she's back. Please, doctor, unmute. Unmute, please. I think our network is really bad. Our screen has frozen.
Ma, can you
Okay.
hear me now?
Yes, we can hear you.
Okay, ma'am. So this is the concluding slide. So basically, asthma is a long-term disease of the airway that leads to several episodes of chest tightness, wheezing, shortness of breath, and when there's good control, it can help the person have a good quality of life. But if uncontrolled properly and not managed well,
Our network is fluctuating, so let's just okay. Let's just wait for her. She'll be back. Let's type our questions, our comments on the chat. Comments, questions before she comes back. For me, there are so many new things. Okay, I think she's back. Please unmute, please. Unmute, doctor. She's not on her seat. Okay. For me, there are so many new things I learned. Asthma does not have a cure, and if one handles it properly, one can still live.
I was trying to get a better network. I don't know. I was trying to connect
You're
to a better
almost done.
network.
Just go ahead. I think we're almost through, right? Just go on. We can hear you now. Well, just go on, go on. You were concluding.
Oh yes, ma'am. I said it's a long-term disease of the airway that leads to several episodes of chest tightness, wheezing, cough, difficulty in breathing. And when there's a good control, it can help you maintain a good quality of life. But if not properly managed and controlled, it can place severe limitations to daily life activities and sometimes can even lead to death. Thank you very much for
So,
listening.
doctor, thank you very much um,
Yes, sir.
for that presentation. Very educative. As I was saying, there are some things I learned from what you said. Your presentation. One, it's an incurable disease. Something is a lifelong thing that must be properly managed for one to live a good life. And
Yes.
that if it is not properly managed, it can even lead to death. Then you did
Yes,
mention that asthma could be worse, I think, for the elderly. With age, it gets
yes, yes.
worse,
The
right?
the rate of
You
death
mentioned
increase
that.
more, yes.
Yes.
The,
And you mentioned the fact that the risk is higher in male than female.
yes,
I think I
especially
also
in
had that.
children, more in males.
More in male children. And then we need to actually watch out for the things we are very allergic to. And you mentioned that even this season, harmattan, the risk is higher.
Yes.
So I'm sure all of us, we picked one or two things, from this conversation, and we probably have questions that we want to ask our facilitator today. So you can ask your question by voice, signify, I will ask you to unmute and ask your question, or you can even type your question. So Dr. Yakub, you can look at the chat and see if there is
Okay.
any question for you, so that you can go ahead and answer the question.
Okay, so there's a question here that says, is it contagious? No, it's not. If I have asthma and I'm living with somebody, a random person that they don't have asthma, no, it's not contagious. So somebody asthmatic that is my friend cannot give me asthma. I hope that answered your question, ma.
Yeah, I think it does. There are more comments and questions, so just please go ahead and respond. Somebody said, according to Dr. Yakub, the occurrence of asthma is more in males than females, and in adulthood, the rate becomes less. Can we infer that as the individual grows,
It's more
in males,
female.
their bodies become stronger in dealing with asthma? Can you respond to that, doctor?
Is there a difference between having allergy and asthma in the chat box?
I think she's still having issues with her network. Okay. I think there are some other doctors in the house on this call. Some of them can assist us. I think I saw Dr. Oduwole. Please unmute Dr. Yakub.
Okay, yeah, I saw a question in the chat box. G and Emima.
And I can see a gadget labeled doctor. I've enabled the system so that you can unmute. You can also assist us in answering some of the questions so that we don't keep waiting. I think Dr. Murita Lastu is also on this call. I've enabled the system. You can unmute and help us with some of the questions on the chat. I think you are fine now, Dr. Yakub. You can go ahead with answers to your responses to those questions.
Yeah, I saw one about allergy, same thing as asthma. So some people can just have allergic rhinitis. Maybe when they're allergic to it, They might just have like few days of that. It does not mean that they are asthmatic or make them to have chest tightness and all of that. Is if they are susceptible to having asthma, that's when they will develop those asthma attacks. So they just have allergic rhinitis that maybe when they're in a cold environment or freezing. So if they're not susceptible to asthma, it won't cause them to have asthma attacks.
Then there's another question. Somebody said, if genetically an individual is not asthmatic, can the symptoms develop later in life due to certain factors or lifestyle? Did you hear that, Doctor? There is a question on the chat. It says, if genetically an individual is not asthmatic, can the symptoms develop later in life due to certain factors or lifestyle?
Yes, ma. Yes, ma. Yes, ma. Like I said, some people can be exposed constantly to some. So asthma present at different points. Can present at different points. So some can be when they are already adults due to combination of different factors. Yes, maybe it can be due to constant exposure. Like some people where they work with certain chemicals or certain materials, and they are constantly exposed to that. Constantly, constantly, constantly. Yes, it can occur later as adults for them.
Okay, thank you very much. So there's another one here. It says, kindly explain more on the preventers like the daily medication to take.
Okay, so for the medications, it is usually given based on severity. So when the patient comes to the hospital, they usually like sometimes they can be presented with a questionnaire where they will feel. So for everybody's medication is not the same. So it depends on the severity and the number of attacks they usually have. They usually have per week, per month, per year. So that's what they will use to basically prescribe medications for them and also how to use it. So some people are giving the low dose and some people are giving the medium dose.
Okay. I think you are taking all the questions here.
The basic number one thing to do is to prevent and avoid gas. That's the one most important step. The subsequent medication is coined based on severity and frequency of the attacks as well.
Okay. So thank you very much, Doctor. I think that's all the questions we have on the chat. So on a final note, what advice do you have for the retirees as relating to asthma? On a final note, final advice that you have for them.
Okay, so I feel
Like a
like
parting shot.
we already have basic knowledge, the most basic knowledge about it now. So some of us can easily identify it. Can you hear me, ma?
Yes, you are audible.
Okay, so some of us can basically identify it. So at least now we know the signs to look out for, and we can watch ourselves, our family members, our kids, just to be able to pick up these signs to know. And maybe if there's a new addition to the family, like maybe a pet, if there's any form of reaction from any of the kids or grandkids, you can easily pick up those signs as well. And also know that asthma is not something, it's not something to stigmatize about and be like, oh, person has asthma, the person is going to die or something. But at least we are more aware of the symptoms now. And also good health seeking behavior. If there's any change in your breathing pattern or you are noticing something different when you inhale something, it's best to go to it immediately to seek better medical care and not just assume that, oh, since we know that it can happen at any point. Different people have their first attacks as adults, so they might not even have that history that, oh, growing up they were asthmatic. But at least now that we know, we can pick up on those signs.
All right, thank you very much, Doctor. So I'm just going to invite someone to appreciate Dr. Yakub on behalf of the state government and all our retirees on this call. So I'm going to nominate, sorry if I murder your name, Yonwato Obarinu Ndei, to please appreciate our facilitator. Please unmute, sir.
Thank you. Thank you, the coordinator. I want to appreciate, on behalf of participants, I want to appreciate Dr. Yekubu for this wonderful presentation. And I pray that God will continue to enrich your knowledge and wisdom in Jesus' name. I also want to thank our HOS, the PS, and most especially the state governor for giving us this opportunity. So we pray that God will continue to take the state higher and higher in Jesus' name.
Amen.
Thank you all and God bless. In Jesus' name I pray.
So, thank you. So, thank you very much once again, our facilitator for today. Thank you all our participants on this call. And most especially, I want to thank Mr. Governor and his deputy for releasing funds for us to continue to run this program. My appreciation also goes to the head of service and PSPSO for making sure that we are live twice in a month. For this year, this will be the last webinar for the year. So I want to say Merry Christmas and Happy New Year in advance. By the grace of God, we will see next year in good health. Like we usually do, I'm going to change the setting. Somebody is signifying, I don't know. Mr. Lamai. Sorry, let's just hear what he has to say. So you can unmute Mr. Lamai. Let's hear you before we now change the setting for us to exchange pleasantries.
Thank you, our director.
Yes, sir.
I just also want to add my voice to the voice of the participants to appreciate you and to thank the state government for caring for us and for continuously updating us on basic health needs. I want to thank you. And you also wish us a Merry Christmas. Thank you for that. On a later mood, we just want to ask about any Christmas largesse or gift to the retirees so that we have a very Merry Christmas. And having participated in this training, whether there's provision for attempt 7 in any way. And lastly, as a result of the biting economic situation in the country, palliative are made 30,000, 35,000 for civil servants. We don't know whether there is any palliative for the retirees. Once again, I want to really thank you, and it's on a later mood. Merry Christmas to everybody. Thank you.
Thank you very much, sir. I think very soon we will hear from the state government. I'm sure something is, the plan is going on as per palliative. But for Christmas, like yes, I don't know anything about that one. So thank you very much for lending your voice. Yeah. So I'm just going to change the setting now. So now all of us can unmute. We can unmute and then say hello to someone we have not seen in a while. Okay. Mr. Odeyin,
Mama, ṣe wà pa.
Mo wà o. Ṣé mo get orúkọ yín ṣe mo pè dáadáa?
Ẹ gbìyànjú. A máa feel àwọn ọmọ àgìrì nígbà tí mo orúkọ wa pè.
Àbí o.
Ṣe wà.
So Mr. Lamai, it's been a while. I've not seen you in a while. How are you doing? I'm greeting you, Mr. Lamai. I said I've not seen you in a while. How have you been? He's not hearing me.
No, we can only see you. We can't see ourselves. We can only see you.
This is the setting of your phone.
Mrs. Durodola.
Ma.
Thank you so much. You and your team, you are dearly appreciated for the job well done.
We thank God, ma.
Good to see you here, ma.
Nice to hear your voice, ma.
Yes, ma. And Mrs. Aladegbe, good to see you here too.
Thank you very much.
Okay, ma. Okay, ma.
Thank you very much, ma.
Okay, ma. Okay, ma.
So thank you very much. I'm going to end the meeting now until next year.
Very much.
Okay, you are still okay. You are still exchanging pleasantries. All right.
Happy New Year in advance. Thank you, ma. Bye.
Mr. Bada.
1 second.
Well done.
New people. Omi pa wà ti pẹ́ ta ti kúrò ní sáfíìsì nìyẹn.
Uncle, ṣé ṣe lè ń bọ̀? Nítorí ó máa ń wọlé, ó máa gbọ́dọ̀ wọlé nù sí. Mama, family nǹkan. Ẹ lọ rà yìí. Rẹpẹtẹ, ẹ máa kẹ́ wá ra o.
Mrs. Fatinikun. Àwọn ti kúrò. Okay. Mrs. Kute Papa ti kúrò. Mrs. Akpena not.
Hello, everybody.
Hi.
Good to see you all.
Nice to see you, Mrs. Kutei. The grandchildren.
Well done. We thank God. We thank God. We are all fine.
Nice seeing you.
Yes, sir.
You're looking good.
Thank you. So are you?
It's nice seeing you.
Yes, sir. This is your Ghana Kushawa. Shawa Dada.
Mrs. Kutei.
Tola, you are muted.
I am still loyal.
Oh, mi ò tiẹ̀ wá mọ̀ pé mo wà muted. Mo lè rojọ́ látàárọ̀. Can you imagine?
Adúpẹ́ máa o, ẹ ṣé o, bí ti sẹ́kù.
Tola, what can we use for frequent
ẹ ṣé o.
Mi ò tiẹ̀ wá mẹ́ni tó ń sọ̀rọ̀ o.
Frequent kata, if somebody is having frequent kata, it used to cause difficulty in breathing at times.
Mi ò máa ń ṣe doctor, ẹ dẹ̀ ti jẹ́ kí doctor wá lọ báyìí.
Ìgbà tí doctor wà bẹ́ẹ̀ bèrè question. Go and do
Ṣeré ní
allergy
báyìí o,
test.
doctor ti lọ.
Go and do allergy test.
Doctor, you have to come back. Oh.
Tolúwa ni mí.
A ní kẹ́ béèrè question ẹ̀ wá béèrè. Doctor lọ báyìí ẹ ṣe
Go
wá ń
and do
sọ̀rọ̀.
allergy test.
Sorry, I was I
identify what
connected from work.
the person is
So
allergic to.
what do you say, ma?
I said go and do allergy test so that can identify what the person is allergic to. That is triggering off the
allergic.
Mrs. Fatiniko.
Because that my own is
Mrs.
not that
Fatiniko,
serious asthma. If I have been cold, let's say like this season is changing now to harmattan now. If the catarrh is like 3 days, 4 days, then it will affect breathing. I'll be using Yela. So that's my own.
Yeah, you can go to the hospital.
Yes, go to the hospital and complain.
All right.
Mrs. Fatiniko ẹ on mute. Mo rí pé ẹ̀ ń sóúnjẹ. Gbogbo alamajọ jóúnjẹ yẹn.
Pátápátá.
Ẹ ní dá jẹ.
So love you and leave you.
Ó dà ń pé network wọn fluctuate, ó sì freeze.
It is.
So until next year, I'm ending the
Merry
meetings.
Christmas and Happy New Year in advance.
Wish you the same. Lágbára Ọlọ́run ayọ̀ látún máa fi pàdé next year.
Amen.
Bye.
Ẹ kú iṣẹ́ Olúwa náà.
Ẹ ṣé ẹ kú iṣẹ́ o. I appreciate you.
God bless you.
I appreciate you all too.